Lompoc Prison is the only outbreak of COVID-19 in Santa Barbara County. The federal prison is currently testing inmates, and the numbers keep rising each day. Fox 11's Scott Sheehan spoke with county leaders about how things got so bad.
There are conditions that are very troubling, and people should not be subjected to that no matter what they're sentenced for.
According to the Federal Bureau of Prisons, Lompoc Federal Prison has about 2,700 inmates. Of those inmates, more than 1,000 have tested positive for COVID-19. At one of their two facilities, nearly 80% of their inmates has the coronavirus.
Certainly a higher number than we would expect, 2 months or so after this outbreak had started.
Cases at the prison make up the majority of Santa Barbara cases by far. And local leaders are frustrated the federal government didn't work with them better.
I think it's very uncomfortable and it's frustrating, and we are urging the prison to move as rapidly as they possibly can. As I said, they were not prepared for the pandemic. They moved very slowly, and they have been jeopardizing not only the health of the prison population, but the guards in our community.
Santa Barbara criminal defense lawyer Bob Sanger has a couple of clients at Lompoc Federal Prison, and he says a major issue was overpopulation.
In my opinion, unconstitutional. People were, in many cases, having to sleep on the floor or were confined in facilities that were designed for far fewer people.
Inmates here at Lompoc Federal Prison are serving a variety of sentences. And the lawyers I spoke to say that the current COVID-19 outbreak conditions their clients are facing inside should not be a part of the sentence.
People are being confined in a place that threatens their lives, and some people are dying. And they weren't sentenced there to death. They were sentenced there for a period of years, usually to get out into society. But they have friends and family and people that love them, and they weren't sentenced to death.
County Public Health says the prison is now testing inmates and built a hospital to treat those who are sick. Public Health says they've offered to help, but there's only so much they can do.
There's really little we can do as we have no direct oversight on federal property. We're happy to offer any support that they would like. We're sort of limited in how we can support them. And if that communication isn't there, then we really will struggle to support them.
We reached out to the Federal Bureau of Prisons for comment, but didn't receive a response. In Santa Barbara, Scott Sheehan.